I'm Sue Glore. I've been with the foundation for about 8.5 years. The Northeast Division actually starts up in Maine and goes down through the state of Delaware. We serve lupus patients and their families, work with partners all throughout that area. Today, I'm going to talk a little bit about what lupus is. I'm going to talk about signs and symptoms, treatment, diagnoses, but the most important speakers today will be Olga Lucia Torres and Chanel Gabriel, who among their many other accomplishments in life are graciously wonderful lupus ambassadors for us who come out and speak. The vision for the Lupus Foundation is a life free from lupus, and our mission is to improve the quality of life for everyone affected by lupus through programs of research, education, support, and advocacy. We really look at everything we do through 3 strategic outcomes. We want to reduce the time to diagnosis, and we'll talk more about why it's hard and why it takes a while to get a diagnosis. We want to make sure people have safe and effective treatments, and we want to expand direct services and increase access to care. And in order to do that, we have to raise the money to do it. So what is lupus? The first answer is a lot of people don't know. 63% of Americans ages 18 to 34 know little or nothing about lupus. So that's something we're really trying to change. 65% of lupus patients list chronic pain as the most difficult aspect. 1 in 3 lupus patients suffer from multiple autoimmune diseases, and I think you'll hear a little bit more about that later. It can take up to 6 years and 4+ doctors to get a diagnosis. So it's not surprising that it's confusing, mysterious, and people often refer to it as the cruel mystery. So lupus is chronic, it's long-lasting, it's not curable. You're going to hear this word heterogeneous, and heterogeneous means if everyone had lupus, it would be like different conditions. Not everybody has the same symptoms, not everybody has the same level of disease activity, not everybody has the same medications. It's something that can be very puzzling to medical practitioners and patients as well. It's unpredictable. It can range in symptoms. We can have increases in disease activities, and we're going to talk a little bit about what we call flares, and then we can have periods of inactivity. Lupus isn't related to cancer, it's not contagious, and it's not like or related to HIV. People get confused because of the autoimmune nature of it. So lupus can affect every organ of the body. And here is just a terrible diagram in some ways of all the different ways that people can get affected. But what you'll understand from looking at this is if you started to have symptoms, so let's say you started to have musculoskeletal symptoms, fatigue, arthritis, pain in your joints, you're not going to think lupus right away necessarily. It depends on what your symptoms are or where you start with your physician. It takes a while because the physician isn't necessarily going to see all aspects of your disease activity. So you see how this again can be very confusing to people. It can affect your heart, your kidneys, your reproductive system, gastrointestinal, central nervous system, all of this. It's called the imitator sometimes because it can show up as other conditions do. There are different forms of lupus. You'll hear SLE, systemic lupus erythematosus, and 70% of all cases are SLE. Cutaneous lupus is the skin lupus, and that's about 10% of cases. Drug-induced lupus, and we'll talk a little bit more about all of these, is about 10%. And then there's something that's referred to as neonatal lupus, which is really not true lupus. It's a condition that with antibodies from the mother, but the mother is not necessarily lupus positive or doesn't have a relation to that. So SLE is the most common form of lupus. We talked about all the parts of the body that can be affected. Common symptoms include fatigue, hair loss, sun sensitivity, painful and swollen joints, fever, rashes, kidney problems. These are just some of them. And so that's a starting point where a lot of people will, start to say, I'm not feeling well. I've had some swollen joints. I'm noticing when I'm in the sun, I'm getting rashes. My hair's falling out. And then that will start some people on their journey. Cutaneous lupus erythematosus is usually what people refer to. You'll hear the butterfly rash. Sometimes people get a rash that across the bridge of their nose onto their cheeks. So a lot of times when you see things about lupus, you'll see butterflies associated with it, and that's why. In about a third of people with systemic lupus, they'll have that butterfly rash. Discoid lupus is about 10% of all lupus cases, and it occurs in 20% of people with systemic lupus. So drug-induced lupus is exactly what it sounds like. There are medications that can induce lupus. There's about 46 drugs that have been identified, and these are some of the most common: hydralazine, quinidine, procainamide. If you were speaking to a practitioner and you were starting to have some lupus symptoms, it would be important for them to know what medications you were already taking just to be able to rule out that it was not drug-induced lupus. The thing about drug-induced lupus is when you stop the medication, the symptoms usually resolve within 6 months. Neonatal lupus, as we talked about, it's not true lupus, it's rare, and it does not mean that the mother or the infant has SLE. So we don't really know exactly what causes lupus, but there are many, many wonderful researchers across the world, literally, who work on it. And the current thinking is that it's a combination of factors: hormones, genetics, environments. So most researchers think that environmental agents can trigger a genetically susceptible individual. You're predestined to be affected in a way that somebody else would not be. Who gets lupus? 90% of people living with lupus are female. Lupus can develop in anyone at any time. There's about 5 million people around the world, and 16,000 new cases are reported each year. And who's most at risk? Women, as we said, it's 90%. Age, most lupus patients are diagnosed between 15 and 44. Some are diagnosed during childhood. People who are diagnosed during childhood generally have more severe disease activity. That childhood lupus is a focus of the foundation. Lupus is 2 to 3 times more prevalent among people of color. And then there is a genetic component. If people have lupus, there's 5 to 13% chance of developing lupus, but that goes higher when you look at all different autoimmune conditions. We talked a little bit about childhood. It's more active, more serious when diagnosed in children, and the average age is 12 to 14. Girls more than boys. And then we talked about who is effective. So in Hispanic and Black and African American communities, there's more severe disease overall, develop lupus a little earlier, experience greater disease activity at the time of diagnosis, and have more neurological problems. And as with any medical condition, there's an economic impact. So even though people have, health insurance or Medicare or Medicaid, it can be very costly in many ways. It can produce a loss of income. There can be additional resources you need. Really, it affects every part of your life: your work life, your physical health, your emotional health, financial health, relationships. Really can affect every part of your life. And to talk to that, I am going to introduce Chanel first. Chanel has been with us from Ambassador, I think, from when we started the Ambassador program, and she'll share a little bit about her journey with lupus.
My name is Chanel Gabriel. I bring you greetings from New York City, from Brooklyn, New York. I was diagnosed with lupus in 2004. I'm a poet and a singer by trade. That's one of the things that I do. I have a poem about lupus. When I was diagnosed, I was in my junior year of college, getting ready to go into my junior year, but my whole sophomore year, I was an overachiever. I was doing so many things on campus. I was super active and excited, and kind of started noticing that I had joint pain in my knee, my wrist. One day it got so bad that I had a friend, my roommate had to put my bag on my shoulder. I couldn't pick it up. And she's like, Chanel, that's not normal. And I was like, oh, I'm probably just tired. I was able to excuse away a lot of the symptoms, especially because no one in my family had any real disease. My sister had asthma. That's about it. So for me, the idea of having a chronic illness was the furthest thing from my mind. I was healthy. I was working out regularly. I was on a dance troupe. And then I started noticing it was harder to get up in the morning. And there's tired, I partied all night as a college student, tired. And then there's this other type of fatigue where literally it felt like my body was pinned to the bed, like I had to drag and pull myself up. Then I'd started getting headaches that would wake me up in the middle of the night. I went to the campus doctor, and they, with all of these random symptoms, which is what makes it really hard to get diagnosed. I'm like, I have headaches, but my knee hurts, but my wrist hurts, but my chest is kind of bothering me. My fingers turn colors in the cold. There's so many different types of symptoms that she was just like, it sounds like you're working really hard in your dance class. Maybe you need to stop working out. And I'm like, okay, maybe that's why I'm tired. But it wasn't until I lost my hair, I was combing my hair and realized that there were several patches missing, that I realized something's wrong. And so the poem I have is called Vanity. And that's literally what I say. Vanity was what made me actually go to my primary care doctor. And I'd seen another doctor, and they were like, your head's bothering you with a sinus infection. Here's some Sudafed. But finally going to that doctor, I literally only presented my hair loss. And I said, I'll talk to you about the other things, but fix my hair. And he was just baffled, like, this random hair loss. he did some blood work and saw that there was a level. They talk about positive ANA. These are some of the other things that help you diagnose lupus. They don't automatically mean you have lupus, but they give you a good clue. And going to him, I was lucky enough that he was very familiar with lupus. A lot of primary care doctors are not necessarily adverse in that. You need to go to a rheumatologist, but he was next door to a rheumatologist. So he started asking me questions. Do you have joint pain? And I was like, yeah. Do you have hair loss? You have the hair loss. You're anemic, And I'm like, well, all, women suffer from anemia. It's like, no. And all of the symptoms that I mentioned were all a part of lupus. So unfortunately able to develop blood clots in my lung. And I think that was the moment where I started really taking my lupus really seriously, because lupus can cause a clotting factor as well. As much as it sounds like, and I think we present all of these things, this is not to scare anyone or anything, or make anyone a hypochondriac that's listening, but it just shows you a lot of times when we see something wrong with our bodies, it's important for us to really advocate for ourselves and to really try to figure out what's wrong. I'm blessed to, be at this point 20 years with lupus. In order to close out, it feels appropriate to kind of share kind of a poem that I wrote about living with lupus. Kind of captures the feelings that sometimes can happen of having lupus. So I'll share it with you all. You think you own me. Squeezed my life in your palms, taken over my body. You think you are me, lupus. You think because you've hijacked this vessel that you're captain. You think you can get away with mutiny, but I see I'm still the same me, the same beautiful butterfly floating on the breeze. I'm not scared to wrestle the wind, to battle Reynard's storms, not afraid to diss this disease, to find peace, be at ease with this disease. I miss my old life without it, but I'm fashioning a new one with this disease. And I know no matter what, there's nothing that will take away my fight. And when it seems to make my day feel like night, I'll still reach for a star. And when it seems my world spins left, I resolve to force it to revolve right. And even if my limbs refuse to move, my spirit will still dance. I'm choosing to enhance this universe with my presence any way I can. I know that lupus is not me, but it's the spark that created a flame. My illness is not me, but it's the source of my vanity. Lupus, you can't damage me because my body is not all I possess. I still have a purpose, a reason to smile. I'm still living my life with no regrets. Thank you for allowing me to share my story with you all.
Oh my gosh, I'm so moved, Chanel, as I am every time you speak. And Chanel undersells. She's performed her spoken word poetry, again, all over the world. And it's just such an amazing force and educator in every aspect. So Chanel, thank you so much for sharing. And with that, I would love to turn it over to another incredibly impressive human being, Olga Lucia Torres.
My name is Olga. I'm going to quickly summarize the beginning. I was in college, double major, first generation. English is not my first language. And I experienced very similar things to Chanel. So I just want to validate those experiences. I would call my father, Papi, me duele el brazo, right? My arm hurts, my this hurts, my knee's swollen. He was like, I'm paying for you to have that insurance. You're going to go. He wasn't paying for anything. I was fully on, scholarships, but, it was the point of that. If you're there, you're going to go to the clinic or the university clinic. And their point was that I was overwhelmed, right? This was, of course, Chanel could be my daughter, but you're going to go and they're going to tell you what's going on. And all I was told was that it was too much for me, right? It was overwhelming. I didn't have other people there like me. Maybe I should take some time off. Maybe I should take less courses. I'm not going to tell you what I wanted to say that maybe they should do, because I'm pretty sure Sue doesn't want me to. So I just had to kind of figure it out, right? Take a lot of Advil, take a lot of Tylenol, and then fast forward to law school, right? Now I was in a more major city, and the symptoms only worsened. And I went now to a major hospital and was told the exact same thing. It was a lot. It was too much. I was carrying the weight of my family on my shoulders. I'm looking behind me. I'm like, no, they're not there. They're actually uplifting me. So I don't know what you're talking about, right? So I just powered through, right? As many women in general do, right? We power through. And then vanity happened. I love that you said vanity did it, right? Put up my ponytail. My hair was much longer. For lupus, we often, when our hair, we get those holes, which happened recently, we cut our hair, and that actually really helps. I think that's universal when hair thins out. My girlfriend says, Olga, you have a bald spot. I said, no, I don't. Right? Because no, I don't. I'm really cute. What are you talking about? And she's like, no, look. And so, the best I could in a disgusting, I used to be a criminal defense attorney. So in a huge courtroom, I do the best I can to look. And I was like, oh no, now I'm going to figure out what is happening. I went to see a dermatologist. The dermatologist sent me to a series of other people, and the same thing, right? I had these weird, I'm going to call them weird high antibodies. And they said, you need to go see a rheumatologist. First of all, I can't pronounce that word. I may have had really good education. That's too many Allah, whatever. No, I'm good. I have another trial to do. It wasn't until I could not get out of bed because my knees were so incredibly swollen that I was like, I never in my mind could imagine that something like this could happen, that I could literally, my body would fail me to that point. I didn't know that I also was having simultaneous kidney failure, right? So it was finally like, my body was like, okay, she's not going to listen to how tired and weak her body's feeling, because I was so committed to attending to my clients that it just finally, they were like, you're not getting out of bed. So let's fast forward to what, I put full trust into my doctors, a million tests, as Chanel will tell you, right? I was like, can you leave some blood in my body? I think some of that needs to stay inside of me. And then all the scans and the invasive testing for, we need a biopsy of this and a biopsy of that. And you're just being flipped in every direction. I have full trust. And then I would start receiving the bills. I'm independent. I start receiving bills. No one told me what all of the out-of-pocket costs were going to be. And then I start thinking, I have to make a decision. I either take care of my health, I get another job, right? I don't know how I can have another job outside of taking care of over 120 clients, or I don't take care of my health. And it took a long time and switching doctors until I got the doctor that said to me, hey, you can apply for financial assistance at the hospital. Oh my God, but I work for full time and I'm an attorney. Yeah, but you don't, like what this costs and how much you make still allows you to qualify. Tears are coming down my face. I want to hug her. I was like, are you not my best friend? Because anybody who's kind to me in my head is my best friend. And also you can get financial assistance for the medicine that you need, which was like a couple $1,000s. Then I can't, we don't even want to discuss how much it is now. It took a long time for me to like repair my relationship or to like even trust people from before, but also moving forward when they were like, you need, and then they like, there's a slew of things. I'm like, how much is that going to cost? Is it covered by financial assistance? Are there programs that could cover this? Enters Lupus Foundation of America, because they also can guide you. Hey, here are some resources. Also, here's Chanel and Olga that have been through it. They can also help you through this, right? I didn't know any of that because there was no internet originally. Let's not tell anybody. But because it's also overwhelming, I think that sometimes healthcare providers forget how overwhelming it could be. So it's really helpful when you can find a healthcare provider that holds your hand, if you will, right, through this. So you get a piece of it and then you go get another piece of it somewhere else. So for me, the moral of this, I pray you don't have lupus, right? I pray a friend or loved one doesn't have it. But if they do or you do, there's help and resources. And if it's something else, again, I pray it's not, there is help out there. My mother had multiple myeloma, cancer in the bone marrow. We didn't pay a penny for either of her transplant. I fought tooth and nail for that, right? My grandmother had colon cancer. They sent us bills. I walked down there like, are you seriously? My grandmother died, had very poor care, and you're going to send a bill? They looked at me and were like, we'll take care of that, and took the bill away. So, a bill is a suggestion. It's a starting point, and you can always push back and get some help.
Thank you so much, Olga, and thank you both for sharing today and everything you do for people living with lupus. I'm so grateful and thankful for you guys. So I think you heard in both stories that, it can be a complicated journey to get a diagnosis. So when you're on the path, some of the things that your medical team will do is they'll review your current systems, your medical history, your family history. Most people are going to start with a general practitioner, a nurse practitioner. Most people are not going to start with a rheumatologist, but you might start with a cardiologist, you might start with a dermatologist, and they're going to run lots of tests. As Olga said, they can be a little bit vampirish, but one of the tests they'll run is an ANA, and that's positive in 97% of lupus cases. So that's one thing they're going to look at. There is no single test used to diagnose lupus. And in fact, lupus experts still debate how much criteria you need to get a lupus diagnosis. It used to be there were 6 criteria out of 10 that had to be met, but that's even broadening. There might be urine tests, there might be anti-dsDNA tests, all these different tests, and then maybe some tissue biopsies. I talked about the fact that it's heterogeneous, again, meaning it can present differently in everybody. Symptoms can vary greatly and change over time. And something I talked about earlier with flares. So when we talk about a flare is when disease activity is high. When you talk to lupus patients, there may be times when their disease activity is very low or even dormant, and we'll refer to that as a remission period. But then disease activity can really flare up. I think apt name for it. That's when you're very symptomatic. We talked about how it can mimic other diseases, the great imitator, and no single diagnostic test. It takes time and multiple visits. Specialists are often involved. Specialists more familiar with lupus. So we're incredibly fortunate here in the New York area in that we have a number of really world-leading physicians who are referred to as lupologists, meaning that they're rheumatologists, but all the patients they see have lupus. One of the things when you speak to a rheumatologist is you'll want to find out, is 10% of her practice lupus, is 20% of her practice lupus, or is 100% of her practice lupus? And you're going to have a different experience with someone who's dealing exclusively with lupus patients. Treatment goals is to reduce inflammation, suppress your overactive immune system, prevent those flares we talked about, treat them when they occur, control symptoms like joint pain and fatigue, and definitely a focus on minimizing damage to your major organs. It does vary based on what organ involvement you have, but prior to when I started with the Lupus Foundation 8.5 years ago, there was only one medication that was approved for lupus by the FDA. Now, that doesn't mean that lupus patients aren't on a plethora of other medications, but that was the only one. We've had some advances in the last couple of years and some new medications have been approved, but you'll see aspirin, steroids are a big part of lupus treatment. Patients and physicians have a love-hate relationship with steroids because they can be very effective, but the side effects can be really horrendous. And so it's really, how do you get the disease activity under control without all the side effects that patients are going to have to live with? Plaquenil, which is an anti-malarial, is often used, hydroxychloroquine, and then we have some biologics and immunosuppressives. So Benlysta was approved in 2011 for SLE, Lupkynis was in 2021, and Safnello in 2021. There's no one magic pill that every lupus patient takes, and that's what you do, but it's good for physicians and patients to have more options when they go in. I think one thing I really want to lean into that Olga said is you are the CEO of your body. You are the CEO of your care. You are a partner as a patient in your care. And so conversations about what medications to take or not take, it shouldn't be your care team saying, you must do this. You need to be talking about what is working for you, how it's working.
In that vein of your being the CEO of your body, I work at Columbia University working with clinicians, teaching narrative medicine, but I also work with patients, and I advocate the patients should create something called a medical resume, right? We spend a lot of time on our own resume, but if you have a chronic illness, there's going to be a lot of medicines you take. I can't remember what worked or didn't work 10 years ago, right? So jot that down. Hey, I tried this medicine, right? That I can't even pronounce, and I had this effect, just a little bit of a rash. Why have to take it again and get a new rash, right? Jot that down somewhere, right? I don't mean an official, beautiful looking resume, but just keep track of that. I'm allergic to this. It's all in one place. God forbid I'm unconscious. My family knows how to open my phone and find it, right? It's all in one place. That's a really, really good thing to have. The other thing that I forgot to say, which I think is important, is that in terms of the medical debt, over 100 million people in America live with medical debt. That's 1 in 3. They struggle with the weight of medical debt, but there's organizations like RIP Medical Debt that can help you get rid of that debt. I never meant to strike fear, like don't get your medicine or don't do the treatment that you were supposed to do. Work with your clinicians, work with the programs that are out there, reach out to organizations like Lupus Foundation of America so you don't end up being one of those statistics. And if you did fall into medical debt, raise my hand, right? I work with organizations that help me get rid of that debt, right? Because these diseases can be costly diseases, but they don't have to be. And that's the great news about it, right? Like when I'm tapped out on steroids, it caused issues with my eyes. I'm like, what else can we take before? Let's see if something else will work before I have to get put on a steroid, right? So always talk with your clinician and say that, last time I was on it, this was the side effect. But that's why having a document like a medical resume helps you write down what that was. I can't remember. I'm like, dang it, I know there's a reason, right? I don't want to take this medicine, but I just can't remember why.
Thank you, Olga. That's amazing advice. And in addition to all of the resources Olga mentioned, the drug companies themselves oftentimes will have programs to help support you financially. So definitely be your own advocate, be prepared when you go in to have the conversations, to ask the questions, and we'll talk about some resources that can help with that. Obviously, take your medication as prescribed, and then there's triggers. There's triggers for flares, ultraviolet rays from the sun, even fluorescent bulbs indoors, sulfa drugs, infections, stress is a big one, smoking. And so you want to describe all new symptoms to your physician, your care team properly, eat a balanced diet, and get plenty of rest and exercise. And with that, I'm going to talk a little bit about some of our programs and resources. The first one is our National Resource Center on Lupus, and all of these can be found at lupus.org. This is a fantastic resource. It has information available in articles, downloadables, podcasts, videos. And so if you're searching for information on any topic, you can put it in the search bar. There's also curated tracks. You can go in as a newly diagnosed patient, as a caregiver, as a health professional. It'll pull information. Content is added regularly to this, so I highly recommend this as a great place if you're looking for info. Part of what's included in there is our expert series. This is a monthly podcast series. I believe we're in our 6th season, so you can go back and look at all the different podcasts that are in there from leading lupus experts around the world on different topics. You can go in and have a listen if there's a topic that is of interest to you. We have education programs like this one. Lupus Connect is our online community of support. And again, you can get to this from lupus.org. There are over 18,000 members worldwide. What I hear from patients a lot of the time is even if they have a great support system and, feel really good and supported and loved by people around them, there's really nothing quite like talking to somebody else who's having a similar experience. And so this is monitored from the perspective of just, no bad behavior, but really it's people talking to people. So you can go on, you can search different threads, you can start a thread on your own, and it's available 24/7. We also have support groups. They're all operating virtually, but you can go to our Northeast page and it'll tell you about the support groups in our area. Our health education specialists are available in English and Spanish. And when Olga talked about, resources, insurance, disability, all kinds of information, you can reach out to them through our website. There's a portal there to send a message to them and they'll get back to you within 48 hours. And they're amazing, amazing people. Take Charge is a 12-week email series we have. So when you start down the road of getting a lupus diagnosis, you have physical symptoms, emotional, financial, relationship. We talked about all of those. but it's also like learning a new language. You're going to start hearing about tests and numbers and what does this number mean? So we really want to empower patients to be able to ask great questions, to be able to be a partner in their own healthcare. So Olga talked about, she called it a medical resume. And so this is something that could help you along that journey. It is an app. It's a website and an app. You can access it both ways, called Self. And this is a place where you can record information strictly for yourself, so that a lot of times if you're having a flare, you might not be seeing your care team for weeks or even months. And then I think, as Olga and Chanel both referenced, you get into the doctor's office and they start asking you a lot of questions. You're like, I don't remember. And also brain fog is something that's very common with lupus patients. So sometimes it really is hard to remember things. So this way you can indicate, if you're having some symptoms, pick up your phone, jot them down. If you're having a reaction to medication, all of this can be in there. And then to Olga's point, either you or somebody who accompanies you on your visit, you'll have all of this information at your fingertips. And then if you're interested, one of the ways that we help advance research is through clinical trials. And so you can sign up for Ray if you're a patient, and Ray allows us to get information about you and your disease activity. It's then de-identified and shared with lupus researchers, because the patient voice in lupus research is so important. We need to have a partnership that involves patients, the federal government, the pharmaceutical companies, the research community, really bringing everybody together to find more answers and treatments. Interestingly, listening to both Olga and Chanel's stories, they talked about being in college, right? So young women are often sadly dismissed when they first go in with symptoms, similar to their experiences. Oh, you're doing too much. Oh, you play a sport or you dance, your joint pain is probably that. So Be Fierce, Take Control is a social media campaign designed for 18 to 25 Black, African American, and Latina women to talk to them about what lupus symptoms are, so that, again, they can be empowered, so they're not so easily dismissed when a doctor says, oh, you're probably just, partying too much, or you're taking too many classes, or whatever the case may be. And that they can say, well, you know what, I see this combination, and I really would like to talk about maybe autoimmune disease or lupus. And then one of our newest initiatives is AIM, which is advancing health equity in lupus. Medical care is not equal, and it does discriminate, and there are real barriers to people getting treatments. So we have a focus on identifying what the barriers to care are, and to help determine solutions to help patients get more equitable care. So that's a lot about us. Now, how can you help? You can advocate with us. First thing you can do is you can become an e-advocate, which is really simple. You can sign up online.
We often just need you to, add your signature on to any bill or legislature that we need you to add your name to. That is legislation that's pro-patient. We'll get more funding for research, things of that matter. Then there is, if you want to sign up to be an ambassador, which is how Chanel and I started, where we either through the computer, right, virtually, you can share your story, can share information why you think that the legislature that's pending would be beneficial to lupus patients, right? And it's a great way to just, tip your toe in the water, if you will. And then if you are able to, you can travel with us to Washington, D.C. Last year, it happened in April. This year, it'll be in May. You'll meet a bunch of other lupus ambassadors. We meet advocates from other foundations. It really helped us to get funding, right? So that we could keep doing this work, but also making a difference for people that live with lupus. I can't imagine not doing this work, right? I have 10 jobs, but I would not ever stop doing this work. Not work, but this is all volunteer work. I want to be really clear.
Olga is actually our advocacy chair here in the Northeast. So grateful. So again, you can just sign up and get more information. Registration has just opened for our summit in May. So we're starting to gear up for that. We also have a walk program. It takes place in the fall. We're in New York City on October 5th down at the Seaport. So more information about that will be coming soon, but that's a great day of support. We usually get a couple of thousand people out, and it's just a joyous, wonderful, supportive day. This is how to reach us.
I just realized how much I don't know about lupus, or didn't know about lupus going into this. And it's so good to have this kind of information and to hear your personal experiences, as difficult as they are and as hopeful as they are too.
The healthcare providers have an entire team. They have nurses, they have billing, the person that takes your blood pressure. You need a team. Don't bring your mother. If your mother's going to cry the whole time she's there, oh my gosh, her numbers got worse. What is that? Don't bring your mother. Bring a level-headed person that can take notes, that could ask questions, right? We need a healthcare team, someone that can help us make decisions. Should I start this biologic, or should I go in and get it as an infusion? Like, should I take it at home as an injection, or should I go in once a month and get it as a biologic? Like, someone that could talk that out with you, figure out who is your team. If you can't bring that person with you, talk to that person the day before, 2 days before, jot down all your questions. And if you're shy, show your provider your question. But like, go in with that person's voice in your head so that you have a sense. And if the provider's like, I gotta go, say, I'm so sorry, but this is the only time I have with you. Can I please just finish asking you these 3 questions? Don't be afraid to do that, because you have a right to get those questions answered. Hear me as an attorney in your head to say, I still need to speak to you for a couple more questions, right? Because you got to have these questions answered, or make use of the patient portal.
On an average, a physician has between 16 and 18 minutes to spend with you. One of the things that the physicians who participate in the program said is, make a little chit chat, but don't make a lot of chit chat. Tiny bit of small talk, but then, make sure it's about you.
And the doctors, if they say, Francis, why did you come see me? And you start answering, take a guess at when do they cut you off?
The first symptom. Or the first
They cut
thing.
you off within 11 seconds on average.
Oh, wow.
11 seconds now. It used to be 24, then 18. Now it's 11.
Huh.
You need to practice what you're going to say, right? Like, have a sense at least of what you're going to say. I say practice. Statistically, the same study, you will stop speaking within 6 more seconds. Like, I came in because my knee keeps swelling. I came in because I fell and now my knee won't stop hurting. So you need to come in and get right to the point.
This is great advice for everyone, whether you have lupus or not. And especially if you're dealing with, the trajectory of lupus and trying to get diagnosed. But like anyone with chronic illness, these are great, great tips. And we really, really appreciate that.